When hospitals must cancel routine procedures to handle the stresses within their walls, we all lose access to the care that we need. And if the state of Idaho must activate crisis standards of care, you or someone you love may be turned away from the hospital or given a lower standard of care because there are too few resources to go around. We are not there yet, but this is something our state has never had to do. Crisis standards of care describes a healthcare situation usually brought on by a draconian natural disaster, like a hurricane, earthquake, or flood. The state of Idaho must activate crisis standard of care during a disaster that overwhelms the healthcare system across a broad geographic region, and its resources cannot be obtained quickly enough to address the shortage. The crisis standard of care Crisis standards of care guides decisions about how to allocate scarce resources, such as hospital beds, medications, or breathing machines. The goal of crisis standards of care is to save as many lives as possible, even when the odds are stacked against us. In the time of COVID-19, here is what it means to you and your loved ones if we reach that point. If your son or daughter gets in a car accident, a hospital bed may not be available for your child, or your child will have to receive care in a repurposed conference room. Your child may have to wait for a procedure to repair their injury until care returns to normal. If your wife is diabetic and has had an infection, she may not get a hospital bed. If your husband has a stroke or heart attack, paramedics may not be able to arrive quickly, leaving him to wait longer for help. Breathing machines or ICU beds may need to be directed to those patients who are most likely to survive because there aren't the staff to run them, while patients are deemed less likely to survive may not receive one. Hospitals and healthcare workers are telling us the need for crisis standard care will arrive in Idaho if we cannot reverse the trend of our rising COVID-19 cases. I want to address the folks who think COVID-19 is no big deal. Regardless of how much you call into question the recovery rates, the death rate, how many cases and deaths are counted, and other topics, the situation in our hospitals right now is not something you can debate. The hospitals aren't fudging the numbers. They have absolutely no incentive to make our current situation seem worse than it is. The problem facing our medical facilities is real. We remain at a dangerous precipice. If we cannot collectively and individually do a better job to slow the spread of this virus, this situation will affect you personally, whether you get COVID or not.